Dr. Blue, how often should bone marrow biopsy be performed in the years following a stem cell transplant?
So typically following stem cell transplant, patients are kind of switched to what we call maintenance therapy, meaning that the disease is typically under control after transplant. And our job right now is to kind of, put the lid on the disease and keep that lid on so that the disease doesn't kind of bubble over. And likely people are on that maintenance therapy for 3, 4, sometimes even 5 years or more. And so sometimes when the disease is very stagnant or very stable and people are on maintenance therapy, there may not be a need for multiple repeated bone marrow biopsies because the disease may just be in this kind of dormant or remission stage. However, at the first sign that we see that things are changing, we see that unfortunately the disease may be starting to relapse, or maybe even there's a new pain or things happening that just need further investigation. I think a bone marrow biopsy would be very warranted at that time.
Okay. So when patients are in a kind of a remission stage, you just monitor them? Do you continue to do blood work and test their urine and so on?
Blood, urine imaging.
Yeah.
Urine
Urine
imaging.
imaging.
Yep,
Yeah.
those would be the best ways to follow it. Of course, the gold standard would be a bone marrow biopsy, but typically what happens is that the blood, the urine, and the imaging typically reflect what's happening in the bone marrow. It would be sometimes very unlikely for a patient's blood work to be normal, but then the bone marrow to be ridden with cancer. Like typically it doesn't work that way. There are some unique circumstances where bone marrow biopsies are needed in people who have something called non-secretory myeloma, but that's a very small percentage.